Lymphoma Unveiled, From Causes to Cures, Mastering the Battle Against Cancer. Get ready to dive into the captivating world of lymphoma in this engaging and informative video. Whether you're seeking answers for yourself or someone you care about, we're here to provide you with the most comprehensive and up-to-date information available. Lymphoma may be a formidable adversary, but armed with knowledge, we can navigate the path towards hope and empowerment. Hey there, welcome back to Mind State. We're here to help you tap into your full potential and become the best version of yourself. In this video, we will walk you through the basics of lymphoma, exploring its definition, the individuals it affects, common symptoms, diagnosis, and groundbreaking treatment options. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is lymphoma? Unlocking the mysteries. The lymphatic system, a complex network of lymph vessels, nodes, and organs, plays an indispensable role in maintaining our overall health and well-being. This intricate system acts as a transportation network, carrying lymph fluid, a colorless liquid containing infection-fighting white blood cells, throughout the body. By doing so, it aids in eliminating toxins, waste products, and foreign substances, thus bolstering our immune response and safeguarding us from infections and diseases. However, when certain cells within the lymphatic system undergo abnormal changes, they can give rise to lymphoma. This umbrella term encompasses a heterogeneous group of malignancies, characterized by the uncontrolled proliferation of lymphocytes, the white blood cells primarily responsible for immune responses. Lymphoma can manifest in various forms, with Hodgkin lymphoma and non-Hodgkin lymphoma being the most prevalent types. Hodgkin lymphoma, named after the physician Thomas Hodgkin who first described it, constitutes a distinct subtype characterized by the presence of Reed-Sternberg cells, large abnormal cells found within the lymph nodes. Although Hodgkin lymphoma can occur at any age, it often affects young adults and individuals in their middle ages. Fortunately, this particular type of lymphoma is generally considered highly treatable, and the prognosis for patients diagnosed with Hodgkin lymphoma has significantly improved over the years. Advances in medical research and the development of innovative treatment modalities, such as chemotherapy, radiation therapy, and immunotherapy, have contributed to the remarkable progress achieved in combating this disease. Additionally, the implementation of personalized treatment approaches tailored to each patient's specific characteristics has further enhanced the efficacy of interventions, offering renewed hope to individuals battling Hodgkin lymphoma. On the other hand, non-Hodgkin lymphoma encompasses a diverse array of lymphomas that do not exhibit the characteristic Reed-Sternberg cells found in Hodgkin lymphoma. This category comprises numerous subtypes, each with its own distinct features, clinical behavior, and treatment strategies. Non-Hodgkin lymphomas can occur in individuals of all ages, and their prognosis varies widely depending on the specific subtype, stage of the disease, and individual factors. Treatment approaches for non-Hodgkin lymphoma encompass a range of options, including chemotherapy, radiation therapy, targeted therapies, and stem cell transplantation, with the goal of achieving remission and improving long-term survival rates. Unmasking the causes, unraveling the puzzle. Genetic mutations are considered a central element in the onset of lymphoma. These alterations occur within the DNA of lymphocytes, disrupting their normal growth and function. While the exact causes of these genetic mutations remain the subject of ongoing research, scientists have made significant strides in unraveling the intricate interplay between genetic and environmental factors that contribute to lymphoma development. Advancing age is one such factor that has been associated with an increased risk of developing lymphoma. As we grow older, our cells are exposed to a cumulative effect of various environmental factors, including radiation, toxins, and infectious agents, which can lead to genetic mutations over time. While lymphoma can affect individuals of any age group, certain types, such as non-Hodgkin lymphoma, tend to be more prevalent in older adults. Additionally, individuals with compromised immune systems face a higher risk of developing lymphoma. The immune system plays a crucial role in identifying and eliminating abnormal cells, including those with genetic mutations. Therefore, conditions that weaken the immune system, such as human immunodeficiency virus, HIV infection, organ transplantation, or autoimmune diseases, can increase the likelihood of lymphoma development. Understanding the interplay between immune function and lymphoma risk provides valuable insights for both prevention and treatment strategies. Furthermore, specific infections have been linked to an increased risk of lymphoma. The Epstein-Barr virus, EBV, a common herpes virus, has been associated with the development of certain types of lymphoma, including Hodgkin lymphoma and Burkitt lymphoma. EBV infects B lymphocytes, leading to genetic alterations that promote their uncontrolled growth and proliferation. Similarly, the bacterium Helicobacter pylori, known for its involvement in gastric ulcers and stomach cancer, has been implicated in the development of certain subtypes of non-Hodgkin lymphoma, such as gastric lymphoma of mucosa-associated lymphoid tissue, MALT lymphoma. These infections highlight the intricate relationship between infectious agents and lymphoma development. Unlocking the treatment secrets, a multidimensional approach. Chemotherapy, a long-standing pillar of lymphoma treatment, involves the use of powerful drugs that kill rapidly dividing cancer cells. These medications can be administered orally, intravenously, or via injection, targeting cancer cells throughout the body. Chemotherapy regimens vary based on the specific type and stage of lymphoma, with the goal of inducing remission and preventing disease recurrence. Although chemotherapy is effective, it can also lead to various side effects due to its impact on healthy cells that divide rapidly, such as those in the bone marrow, gastrointestinal tract, and hair follicles. Nevertheless, medical advancements have allowed for the development of improved chemotherapy protocols that minimize side effects and enhance treatment outcomes. In recent years, targeted therapies have emerged as a promising approach in the treatment of lymphoma. These therapies are designed to selectively target specific molecules or pathways involved in the growth and survival of cancer cells, while sparing healthy cells. By precisely honing in on cancer cells, targeted therapies can enhance treatment efficacy and reduce the occurrence of side effects. Examples of targeted therapies used in lymphoma include monoclonal antibodies, which are immune proteins that bind to specific targets on cancer cells, and small molecule inhibitors that block specific signaling pathways crucial for cancer cell growth. These therapies are often utilized in combination with other treatment modalities, further augmenting their effectiveness. Immunotherapy, a groundbreaking approach that harnesses the power of the immune system to fight cancer, has revolutionized the landscape of lymphoma treatment. This cutting-edge treatment strategy involves the use of immune checkpoint inhibitors, chimeric antigen receptor, CAR, T-cell therapy, and antibody-drug conjugates, among others. Immune checkpoint inhibitors work by unleashing the body's immune response against cancer cells, while CAR T-cell therapy involves reprogramming a patient's immune cells to specifically target and eliminate cancer cells. Antibody-drug conjugates combine the targeted nature of monoclonal antibodies with the delivery of potent anti-cancer drugs, precisely directing them to cancer cells. The decision-making process regarding the choice of treatment options for lymphoma is highly individualized and takes into account several crucial factors. These factors include the specific type and stage of lymphoma, the patient's overall health and medical history, as well as their personal preferences. Close collaboration between patients and their healthcare teams is essential to devise personalized treatment plans that maximize efficacy while minimizing potential adverse effects. Regular monitoring and assessment throughout the treatment journey help gauge response to therapy and make any necessary adjustments to optimize outcomes. Armor up. Prevention strategies that matter. Maintaining a healthy immune system is crucial in reducing the risk of lymphoma and other diseases. Our immune system plays a vital role in identifying and eliminating abnormal cells, including those that could potentially develop into cancer. To support immune health, it is essential to consume a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. These foods provide essential nutrients, vitamins, and antioxidants that bolster immune function and help protect against cellular damage. Additionally, staying hydrated, limiting alcohol consumption, and avoiding tobacco products are key factors in maintaining a robust immune system. Regular exercise is another important aspect of lymphoma prevention. Engaging in physical activity not only helps manage weight, but also improves overall health and well-being. Regular exercise has been associated with a reduced risk of various cancers, including lymphoma. Aim for at least 150 minutes of moderate-intensity aerobic activity, or 75 minutes of vigorous intensity activity per week, along with strength training exercises. Finding activities that you enjoy, such as brisk walking, cycling, swimming, or dancing, can make it easier to incorporate exercise into your routine and make it a sustainable habit. Avoiding known risk factors associated with lymphoma is also vital in prevention. While some risk factors, such as age and genetic predisposition, are beyond our control, others can be actively addressed. For instance, exposure to certain chemicals, such as pesticides, herbicides, and solvents, has been linked to an increased risk of lymphoma. Taking precautions when handling such substances, using protective equipment, and following safety guidelines can minimize exposure. Similarly, infections like Epstein-Barr virus, EBV, and Helicobacter pylori have been associated with lymphoma. Practicing good hygiene, such as frequent hand washing, and seeking appropriate medical care for infections, can help reduce the risk. Regular medical checkups and screenings also play a crucial role in early detection and prevention. Routine examinations allow healthcare professionals to assess overall health, identify potential risk factors, and detect any abnormalities that may warrant further investigation. It is important to follow recommended screening guidelines and discuss with your healthcare provider any concerns or family history of lymphoma or other cancers. Being diagnosed with lymphoma can be overwhelming, but there is ample reason for optimism. Advancements in research and treatment have significantly improved outcomes, allowing patients to achieve remission and regain normalcy. By educating ourselves, seeking support, and making informed decisions, we empower ourselves in the battle against lymphoma. Remember, you are not alone in this journey, and with continued research, the future holds even greater promise for conquering lymphoma. Thanks for watching, MindState fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.